281, 35.
281.35.
Oral, I am, IV.
Oh, okay. He named
What
it.
else? Rectal.
Angie, whatever that means.
Oral. Fuck you.
Under the skin.
Joe, Joe.
I know that one's down now.
PONG tube, that is by mouth, by nasal gastric tube.
Oh,
Put it in a tube, nasal gastric, meaning it goes to the nose and into the stomach. Or we have a gastric tube, which just goes straight into the stomach itself. Whatever can go by mouth can go by either nasal gastric or gastric tube because it's going in the same place, going into the stomach. We have sublingual. How about medication like nitroglycerin? It's all under the tongue. Medication, chicken gum. I haven't used those very often yet. The only thing that I've used often between chicken and gum is sugar for diabetics. When I worked long-term care, I would carry a little tube of icing that I bought from the supermarket, put that in my pocket. When someone was having symptoms of hypoglycemia, you squirt some chicken gum, you rub it, and within, what, 15, 20 seconds, that's normal. Better noise. So we have topical transdermal patches.
is it a certain place for those patches to go when you say in
On the skin.
Just yeah, no, yeah, on the skin.
That's-
I mean, like.
I know what you mean. But yes, it's generally over an area that's not covered by bone, generally.
Oh.
Or that have bone in the knee, generally.
Okay.
But it's not limited by that by any means.
Okay.
Any place you have skin that you can put little.
Okay.
And we have installations, which is kind of topical, but those are things that get placed into, like nose drops and ear drops and sprays and so forth. It's kind of interesting, most of our medications are now turning into nasal sprays, aren't they? I've got severe allergies. I acquired them when I moved to Texas.
I know, me too.
So I did a steroid once a day, and increased the allergies, nothing else did. You know, but energy they have for testing for diabetes, and I mean, who knows, maybe all the other kind of medications will go away. We'll just have a drugstore full of nasal spray bottles, just pick the right color and get it done. Then we have inhalation, we have medications which are breathed in. Anyone with asthma, you have a little inhaler where you squeeze it and you breathe in the particulates in order to clear up your asthma. We have suppositories. I had a patient that was given suppositories and thought he was taught very well. And after a couple of days came back and was saying that suppositories weren't working. I said, okay, well, explain the process, how often you take it, and so forth. He said, well, I'm taking them twice a day, okay. And he said, yeah, I'm taking out the silver wrapper, which is number one. Thinking, oh, silver wrapper. And I said, okay. And he says, but it takes 2 glasses of water to get it down. Now we know why it's not working. Peripheral. What's that mean? Who can tell me that? Okay, through a vein. Okay. It's through a needle. IV, IM, subcutaneous, intradermal. And they're giving in these areas because get into the body. That's all we'll say about that. Okay, we had this one already, didn't we? Okay, hang on a minute, let's do this. I don't think we need a full rotation. We had this one already, right?
Yeah.
And we had this one already. Remember that?
Yeah.
Yep.
1 plus 1 equals 2, and 1 plus 1 equals 4. Now you remember.
Yep.
So, additive effect, two medications that would have, you have the sum of the effects. Consider this where one enhances the other. We have a compounded effect. That before you give a medication like Percocet, which are acetaminophen and oxycodone, is that they work together to increase the effect of antagonist. We talked about that. 1 plus 1 equals 0. So first, can we give a Naxalone, which is Narcan, and it blocks the effects of the narcotic, and the person is back to normal. And that takes a matter of seconds, by the way. Give that medication, and the person is back to. Oh, okay. For those of you who are my age, you've heard of a guy named Stephen Wright. That's one of his. For those of you who are younger than me, go on the internet. Yes. In Baraboo, Wisconsin, as a matter of fact. Yes. Oh, capital of the world. Medication, we also have FDA pregnancy risk factors. A through X. A means it does the least amount of harm. X means that it will kill the fetus. And you have everything in between. For women who are pregnant or think they might be pregnant or getting pregnant, generally if you get the medication, you have to find out what the risk factor is and is it going to cause an issue or not. These are medications which would cross the placental barrier. Not effective. Drug interactions. We have medications like cold remedies and high blood pressure meds. Cold remedies, depending on the high blood pressure medication taken, cold remedy will actually cause the hypertensive medication to become more effective or least effective than what's going on. So if you're taking medication and you're searching for the thing that unclogs your nose, you actually have to read the label and find out is it going to do something to you or not. Antacids can impair and reduce medication absorption by changing pH. We talked about that in the stomach, that with the high acid content in the stomach or low pH, that the medication is dissolved faster, and then it gets into the system. Where if you have a higher pH, you cannot dissolve all this. Some medications are taken with antacids for the fact of comfort to the stomach, because the absorption is not effective. But for the most case, that it does. So you teach need to teach taking antacid 1 hour before or 2 hours afterwards. Food can affect the medication. And we tell them the same thing, taking medication 1 hour before or 3 hours after. We tell them 3 hours after because it takes 2 hours for the stomach to empty of food. I mean, you can just drink water and so forth and it goes right on through, but otherwise it takes a while for it to digest.
You mean of meds, right? Food can affect absorption of meds.
Yes, sort of the absorption. Food will affect the absorption of food. It certainly will. But medication. I've talked to my secretary. These are things that we've talked about.
Yes.
Pharmaceutics, pharmacokinetics, pharmacodynamics. Medication. And that wasn't so painful, was it? You're not making a happy face. Was it painful?
Let's see after the test.
We'll tell you on the test.
Okay,
Yeah.
very good. Good answer. All right. The things that we talked about already, just putting them in the diagram form. Have you been discussing the nursing process so far? Fundamentals.
Yes.
So what's the first part of the nursing process?
Assessment,
What's the next one?
diagnosis,
And
Planning,
plan,
implementation,
evaluation.
evaluation. You will find as a nurse that once you get this into your head, you'll start using it all the time.
Sometimes it doesn't.
My wife and I will be watching something on television and we're assessing the situation and we're making a diagnosis to it. My wife's a nurse also. Or we'll go in the mall and we'll watch somebody walking in the mall and how they're walking or what they're saying or their facial expression. We start making nursing diagnoses. When you're going through working as a nurse, you use this all the time. I had a nurse on the floor one time say, well, we don't use nursing diagnoses anymore. We don't use care plans anymore. Well, number one, yes, they do. But second one, so I asked the nurse, I said, okay, well, tell me what you did with your patients this visit. They assessed them, they diagnosed the issue that was going on, they made a plan of action, what needed to be done, they gave them a treatment, and they're getting ready to go back to evaluate how it worked. Hello. I will not cover nursing process in depth in this class whatsoever, but we'll use it periodically to go through medications. But I will not be covering it in depth. I'll be with fundamentals on the other courses. There's the nursing process. However you want to use it, but it's the ad pie, a delicious pie versus an apple pie. We don't use analysis, we use diagnosis. That you already told me about. This is a short clip. Preventions of health problems. If it causes you to distress, don't do it. The one thing that always make sure that if you have kids, you always make sure you put stuff away. Because I worked in an emergency room, and we were a poison control center, so we get kids in all the time. We ingested the strangest things, and if you ever had to give activated charcoal for a kid, or had to pump some kid's stomach out, you make sure that you never had this stuff around where a kid can be infected.
You forgot to.
Forgot what? Oh, related to.
So secondary, primary prevention, don't do it. Secondary prevention, fix it before it gets worse. Tertiary, prevent problems after diagnosis. It says, i.e., support groups for cancer patients. We'll talk about that more as we lead into that chapter. And don't buy drugs on the internet. I can get Vicodin for 34 cents a tablet.